Hello and welcome to this video where we're going to be talking about health promotion in line with the World Health Organization's perspective. Before we go further, let us define health promotion. The World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health. The WHO further defines health promotion approaches as including modern health education and consisting of community action, supportive and accessible environment, health policy changes, health service modification, and development of personal skills. Therefore, health promotion is not just the responsibility of health sector, but goes beyond healthy lifestyle to well-being. Now, let us look at what public health professionals consider as the prerequisites for health in health promotion. The fundamental conditions and resources for health in health promotion are peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity. Therefore, improvement in health requires a secure foundation in these basic prerequisites. Consequently, health promotion enables individuals, families, populations, and communities to adopt or adapt lifestyles that promote and improve health. It helps the community members to make the right choices that can improve their health. Evidently, each individual, population, and community have factors that influence their health either positively or negatively. However, health promotion enables everyone in their context to identify these factors and increase control over these factors to enable them live a life that improves and promotes their health. Meanwhile, how can this be achieved successfully? Promoting health is a series of action. It is not promoting in the usual sense. Promoting health involves more than just telling people how they can take care of themselves. It also involves informing individuals, families, and population about what they can do to be healthy. Also, identifying characteristics of communities that influence people's health or well-being in the community. Supporting those who are in need so they can be helped. Assisting people in improving their control and health, and including all the people in the context of their daily life activities that promote health, instead of focusing on specific groups at risk of disease. Now let us paint a practical example of health promotion in the context of healthy workplaces. Globally, an estimated 2 million people die each year as a result of occupational accidents and work-related illnesses or injuries, and 268 million non-fatal workplace accidents result in an average of 3 lost work days per casualty, as well as 160 million new cases of work-related illnesses each year. Healthy workplaces envision building a healthy workforce as well as providing them with healthy working conditions. Healthy working environments translate to better health outcomes for the employees and better business outcomes for the organizations. So finally, why is health promotion important? Health promotion improves the health status of individuals, families, communities, states, and the nation. Health promotion also enhances the quality of life for all people, and health promotion reduces premature death also. By focusing on prevention, health promotion reduces the cost that individuals, employers, families, insurance companies, medical facilities, communities, the state, and the world at large spend on medical treatment. In summary, health promotion focuses on achieving equity in health. Health promotion action aims to reduce differences in current health status and ensuring equal opportunities and resources to enable all people to achieve their fullest health potential. Meanwhile, subscribe to this YouTube channel for more videos on our public health lecture series. Please like this video if it was helpful and leave your comments below.